The Alert Patient Data Management System, or PDMS, provides a timeline view of a patient's events and indicators. By capturing information directly from patient care devices, this software allows healthcare professionals to have more time for what really matters, taking care of patients. Alert PDMS is organized into modules, and its main feature is allowing professionals to relate different variables to one another, from vital sign indicators to administered medication, from lab test results to executed procedures, and so on. This all starts at the time of capture. A small device called the Alert Cap, which is similar in size and shape to a portable DVD player, is connected to different patient care devices and captures information from them. The patient is uniquely identified within the Alert Cap by scanning the barcode on the patient's bracelet or manually entering the patient's identification number. The patient's name, age, gender, identification number, and photograph are displayed on the Alert Cap screen. The devices connected to it are also identified, and their statuses are displayed. By identifying the patient in the cap, all the data retrieved and processed by the device are connected to the patient's EMR. When necessary, such as in cases of transport, power failure, or network problems, the cap can run autonomously and continue capturing and storing data for approximately 24 hours. The captured data is then synchronized once connections are re-established and displayed in Alert PDMS, which is presented in full screen. Information is displayed in a time-oriented format. This slider may be used to read and index values. In addition, screen arrangement and modules can be set by the facility as well as by each individual user. The time frame is set by the user, who can navigate back and forth by dragging the time toolbar. A specific moment in time can also be selected using the Go To button. Modules are presented as graphs, tables, or tasks. In graph mode, each parameter is color-coded and has a unit that can be associated with its respective unit scale. Both the parameter and the entire module can be hidden. In table mode, values are displayed according to the time of capture. Modules can be collapsed and arranged on the screen so as to suit the user's preferences for viewing the available data. The medication module presents administration tasks. It receives information sent from infusion pumps and makes it possible to view the perfusion rate or even the amount of medication being administered. The intake and output module displays the patient's amount of fluid intake and output. This information is sent from infusion devices, or it can be manually entered. The amount of fluid shown corresponds to the chosen time frame. In the lab tests module, lab test results are shown either in a graph or a table, making it possible to follow the patient's evolution throughout the period of care. The severity scores module displays the evolution of the patient in terms of severity assessments. The Cases and Events module tracks all activities involving the patient. The professional can also mark, tag, and comment on specific events in time. The same applies to cases, which are prolonged events such as hemodialysis or arterial cannulation. In accordance with local and international legislation, captured data must be validated. By selecting the Manage Captured Data feature, the user is directed to a wizard where captured values can be marked as valid or invalid. Alert PDMS was created with the critical patient in mind. It intends to replace handwritten medical files and eliminate the time-consuming task of transcribing data from patient care devices to their respective charts. It is meant to be used in intensive care units, operative rooms, emergency rooms, and even in step-down units such as intermediate post-operative care, cardiac care, and so on. Virtually all captured data can be exported to the Alert data warehouse and then processed. The full potential for finding relations among the numerous variables and indicators for patients in critical care environments has yet to be discovered. To find out more about Alert and our software solutions, please visit our website. Thank you for watching.